Doctor, why do I keep losing my pregnancies? At first, I was told my cervix is loose, and I did stitch, and still the child died in the womb. Okay, today we are going to learn about recurrent pregnancy loss because that's what this woman is experiencing, and she has asked an important question, so I thought I should answer. Recurrent pregnancy loss for Uganda is defined as loss of two or more concurrent pregnancies. Okay? Loss of two or more concurrent pregnancies. That would mean that if you've lost this pregnancy in a miscarriage, and then the next pregnancy also becomes a miscarriage, you should be investigated. Some people lose up to 5 pregnancies before they come to hospital to ask this question. Now you get the answers. Most pregnancies come out before 12 weeks. Most pregnancies come out before 3 months. And usually the explanation is a chromosomal abnormality. Your egg or sperm that formed that child was dented. Okay? That could be the quickest explanation. But there are so many other explanations. Alright? Now, you have gone to hospital and have seen for antenatal, and the midwife or doctor has asked for blood group. Do you know why? Because if your blood group is rhesus negative and your husband's blood group is rhesus positive, maybe I'll make a video about blood groups also. But if someone said your blood group is A negative, your blood group is B negative, or B minus, or O minus, then that means we need to find out your husband's blood group. If it is anything plus, A plus, AB plus, O plus, then when your baby is born, we need to give you anti-D. Anti-D is medicine that stops the reaction that happens when your baby's blood, which could have the blood group similar to their father, mixes with yours and creates a memory to attack the next babies. So you've seen those those couples whose first child was normal, and then the rest of the pregnancies have become miscarriages. That's the explanation usually, that the blood of the first child mixed with that of the mom, and now the mom's blood is very hostile to the next babies that share a blood group with their elder sibling. So either the baby dies from inside or you keep on getting miscarriages. Now let me come to this lady who even put a stitch. You should know that we do not put a stitch before 12 weeks. We don't put a stitch before 12 weeks. And why? Because many pregnancies that are malformed, it's not true that every time you conceive your baby is going to be a normal baby. But if your baby is abnormal, by the time the pregnancy makes 3 months, most pregnancies have come out. But the other explanation for why you could have a miscarriage after 3 months, especially between 3 months to 6 months, is cervical incompetency. What she said here, that they said the cervix is loose. Yes, as the uterus, if your uterus is non-pregnant, the cervix might be normal, okay? Might be of the normal shape, normal size, and it has nothing to push it to open. But once you conceive and the baby continues to grow in weight and size, then your pregnancy might actually come out because the cervix opened prematurely, what we call an incompetent cervix. And an incompetent cervix is treated by a stitch, which we insert every time you conceive and remove at 36 weeks to be able to allow you to deliver normally. Now, a stitch is not the only reason, rather an incompetent cervix is not the only reason why you could lose a pregnancy between 3 months to 6 months. The other common cause is uterine structural abnormalities. You might have a uterus that is malformed, that is not similar in structure with that of other women. For example, there are women whose uteruses have 2 compartments. Okay? which we call a septate uterus. Okay, there are those women who have almost two completely separate uterus, two completely separate ones, and you can never know until someone has scanned and also performed maybe hysteroscopy to tell you exactly which kind of uterine abnormality you have. That double uterus is called uterine didelphys. Okay, now, but the other cause could also be that you have masses in the uterus, such as uterine fibroids, myomas, and that a baby reaches a given stage and has no space to grow whatsoever. Okay, and that can also be a cause of a miscarriage. If you put a stitch and the baby dies from inside, then there is the most probable explanation is that your baby has something that attacks them by your immune system. There are women who have a history of maybe having a blood clot in their leg, have a clot in their lungs, and they've survived that. Okay, and then there are those who have no history of that whatsoever, but they are having recurrent miscarriages. There is something called antiphospholipid syndrome. In antiphospholipid syndrome, you keep on making very small clots in small blood vessels, but they occlude blood flow to the babies. So we see that these women keep on having recurrent miscarriages. A tip: while you need to see a gynecologist to tell you the exact reason why you're having recurrent pregnancy losses, you might benefit. This is not a one answer serves all kind of solution, but those people whose problem, especially those who are losing pregnancies in the first 3 months, you might benefit, okay, from taking aspirin starting at least a month before your intended conception. So for example, this is July. If you intend on conceiving in August, you better start aspirin now. Okay, aspirin, the doses differ, but we prefer that you take 150 milligrams. Some brands on the market, the commonest now, are called Recurrent. Okay, you might benefit from taking that starting a month before you conceive up to 36 weeks of the pregnancy, so around 8.5 months. It does play a big role. There might be questions on how it works, but the science is deeper, and I am not going to share that for now. However, if you have a miscarriage now and you get a miscarriage the next time, see a doctor before it becomes a routine. Okay, the doctor might have better explanations. A disclaimer: almost up to 60%, almost up to 60% of all pregnancy losses, we as doctors do not have an explanation. We can't figure out why you're having a miscarriage. Okay, and usually that is for women who are losing pregnancy once in a while. They come to hospital and ask, doctor, what is the reason for my miscarriage? Sometimes it is too expensive to pinpoint exactly why you're having your miscarriage. Okay, but should you lose 1 or 2 more pregnancies, come to hospital, have yourself investigated, and we'll give you answers and solutions to having a live baby. Thank you very much.